Hey, are you looking for information about the symptoms of Lyme disease, what it does, where it comes from? How about just overall Lyme information? Check this out. Hello everyone, Dr. Jason West, and we're going to talk about one of my favorite subjects, and that's Lyme disease, and specifically the symptoms of Lyme disease. And why are we talking about it is it's so misdiagnosed, it's mistreated, it's misunderstood, it's the great imitator. You know, so many times when people come into the office with Lyme disease, it doesn't surprise me when they start telling me, my stomach doesn't feel very good, my hormones are upset, I can't sleep at night. And I have this joke inside the office that for some reason, Lyme disease turns you into a vampire. It makes it so that you can't go to bed at night and you can't stay awake in the day. And I have my own hypothesis. I think that the bacteria actually gets into the pineal gland, and when it gets into the pineal gland, what it does is it disrupts your sleep patterns. And obviously, it's recognized that Lyme disease can cause some polyarthralgia, which means that we have symptoms of pain in the joints, it's migrating, it causes a lot of stomach problems, it can cause heart problems, breathing problems. I think Lyme disease likes to get into the organs, into the thyroid, into the adrenal glands, and into the ovaries or the gonadal tissue, and it causes a lot of hormone imbalances. I just think that wherever the body is weak for that particular patient is where Lyme disease basically sets in. Now, the traditional medical teaching of Lyme disease is that it's a vector-borne illness, which means that the bacteria basically comes from a tick. You get a bullseye rash. You have to be in certain parts of the country to actually have Lyme disease. I don't believe that, but that's what the traditional medical model teaches, and that a short course of antibiotics helps everybody. Now, it is recognized by the CDC that in small instances that you can have something called PTLDS, which is post-treatment Lyme disease syndrome. Now, I think it's way more than just the short, percentage that the CDC says it is, because I think it causes a huge long-term chronic health problem. So it's more than just a vector-borne illness. It's more than just a short course of antibiotics. There's a huge problem with Lyme disease. Now, some of the treatments we're going to talk about are in the next video, and also some of the testing. But the highlight of the myths or the misconceptions about Lyme is that it's everywhere. And my perspective is that nothing surprises me when it comes to Lyme disease. When people come in the office and they tell me about their symptoms, it doesn't surprise me what happens. I think that neurologic disorders, you need to make sure that you don't have Lyme disease, because I think Lyme disease really likes the nerves, so peripheral neuropathy, it can cause MS. I think it's a huge flare in Lou Gehrig's disease or amyotrophic lateral sclerosis. And my advice for people that have Lyme disease, or that you think you have Lyme disease, is to make sure that you get to someone that's a Lyme literate doctor, and also that you do the testing. Now, in one of the future videos, we're going to talk about the 5 phases of Lyme disease, because there's a spirochete phase, there's a spore phase, a biofilm phase, an intracellular phase, and a budding phase. And I believe that medicine only really tests for 20% of the life cycle. They're looking for the spirochete, or they're looking for the antibodies, or possibly, the CD57 response in your immune system, but they're only checking for about 20%. And I think that's why there's so many false negatives in people that have Lyme disease. Now, the way to get people better with Lyme disease is you've got to balance on every level. You got to start with a lifestyle, you've got to do some mind-body healing, you've got to make sure that you stimulate and upregulate the immune system, and you've got to make it stronger. And you balance on every level. And there's no such thing as a Lyme protocol. There's a Rebecca protocol, there's a Jason protocol, there's a Nate protocol, there's a Maxine protocol, or a Lori protocol. You have to treat people individually. And one of the keys to success with Lyme disease is to incorporate immune system stimulation therapy, high-dose vitamin C therapy, hydrogen peroxide therapy, UVLRX therapy, ultraviolet blood irradiation therapy, healthy cell therapy, and something called neural therapy. Now, I've talked about neural therapy in the other videos, but what that is it's a way to reset your nervous system. So if your body was not working very well from Lyme disease or an autoimmune disorder, and it was a computer, and we called up tech support, and we said, you know, the body isn't working right. Tech support's going to tell us that you need to reboot the system. Now, I have this terrible joke in the office that I can't really kill you and bring you back to life, but using the principles of neural therapy, you can actually get those nerves to open, close, and reset. And why that's important, because many people that have Lyme disease, their body becomes used to being sick. They don't even remember what it's like to be healthy. And using neural therapy and making sure that the body is healthy and resetting those nerve synapses and those nerve transmissions, I think is a critical component of neural therapy. We have hundreds of video testimonials that you can see later in the videos, and if you'll search YouTube for West Clinic video testimonials or daily dose of vitamin H, you'll see that there's proof in the pudding that you can take someone that has basically got one foot in the grave from Lyme disease. I've seen people come out of wheelchairs. I've seen people that have had these terrible autoimmune problems, and they get better. Now, that doesn't mean that everybody gets better, but what it does mean is I think there's some wonderful options for using those therapies to improve your outcome. I always tell people this: Lyme disease is not an antibiotic deficiency disease. What that means is antibiotics, I do think they have their time and place, but it's so difficult to just hammer people with an anti-life therapy. And I say anti-life because anti means against, bio is life, in that therapy. So anti-life therapy isn't very conducive for long-term outcomes, in my opinion. And I recognize that there are Lyme clinics that do long-term antibiotics and some of their people get better, but I sure see a lot of those that end up in the office, and you have to start over from ground zero and get them better. So if you are committed to your health and success and put your body in balance, I think that you have a way better outcome than just giving up, which I see so many people with chronic Lyme do, and it's unfortunate. That's just a real quick overview of Lyme. I'm excited to tell you about the testing and the treatments available. This is Dr. Jason West, and I'll see you in the next video.